Hi there, my name is Ashley. I'm going to be performing a head-to-toe assessment. So before I proceed, I'm going to go ahead and check my patient's chart. I'm going to make sure their demographic matches up, check the physician's orders and their MAR. Then I'm going to go ahead and grab my supplies, which consists of my stethoscope, my Q-tips to test for certain cranial nerves, and alcohol prep pads, and my pen light. So now I'm going to go ahead and perform hand hygiene. I'm going to foam. And now I'm ready to enter my patient's room. Hello.
Hello.
My name is Ashley. I'm going to be your student nurse today here at Valencia Memorial Hospital. I'm just going to go ahead and close up the curtains to give us some privacy, okay? Okay. And then, am I able to see your wristband?
Of course.
Okay. Can you state your full name and date of birth?
Yes, Millie Andrew Boisron, November 4th, 1999.
Okay. MRI matches to which on the computer. Okay. You can go ahead and put your wristband down. And then, Millie, do you have any allergies to food, medications, or environmental factors?
No.
No? And on a scale of 0 to 10, are you in any pain?
No. 0.
Okay, and do you know where you're at right now?
Yes, I'm at Valencia Memorial Hospital.
Okay, and do you know what's today's year?
Yes, 2021.
Okay, so you're alert and oriented times 4, and then on a scale of 0 to 10, are you experiencing any pain?
No pain. 0.
No pain. Okay, so here I do see that you have a head-to-toe assessment due, which is just me inspecting your body, listening to your lungs, your heart, and your tummy. Is that okay?
That's fine.
Okay, so I'm going to go ahead and close the computer and start the assessment. Okay, so right off the bat, I'm going to go ahead and start inspecting your head. I notice that you have even hair texture throughout, even color distribution, no bald spots, no protruding masses, no lesions that are noticeable upon inspection, but I will confirm upon palpation. Your ears upon inspection, I don't see any abnormal discharges, no abnormalities with color whatsoever, no foreign bodies. It does look symmetrical from side to side of your face. And now I'm going to go ahead and start to inspect your eyes, okay? So your eyebrows and your eyelashes, even hair distribution and color. I don't notice any swelling, no bruising in your eyes whatsoever, no signs of edema at all. I'm going to go ahead and start to inspect your actual eyes with my pen light. Okay, so your sclera is nice, white, opaque, your cornea curved and clear. Can you go ahead and lower your eyes? So your conjunctiva is nice, pink, moist. Awesome, thank you. And now I'm going to go ahead and look at your pupils and your iris. Your iris is that nice, beautiful brown color. It's round. I don't see any masses that would compromise that circular round color of your iris. And now I'm going to go ahead and measure your pupils, which I would state would be a 4 millimeter to 3 millimeter. Okay. Now I'm going to test your reaction to light. Okay.
Okay.
Reaction to light is intact. Now I'm going to test for your accommodation, so I want you to go ahead and follow this pen light. So accommodation is intact. Now to test for cranial nerve 2, if we had a Snellen chart, I would go ahead and use that Snellen chart. Since we don't, we will. And now for cranial nerve 3, 4, and 6, I'm going to go ahead and see if there's any nystagmus present, okay? So I want you to go ahead and follow this pen light. Okay, no nystagmus present. Awesome. Okay, so now I'm going to go ahead and look up your nostrils. I don't see any signs of epistaxis, no foreign bodies. Awesome. And now I'm going to go ahead and look at your mouth, okay? Go ahead and open up. Okay, the oral mucosa is nice, pink, and moist. Tonsils are present. I would call it stage 1. All teeth are there, no dental caries, nice and white. I don't see any lesions going on with the tongue whatsoever. Amazing. Okay. And now I'm going to go ahead and start palpating the rest of your head, okay?
Okay.
Okay. Also, I want you to go ahead and smile for me. Frown. Go ahead, lift up your eyebrows. Puff out your cheeks. Cranial nerve 7 is intact. That small little test. Okay, gonna go ahead and palpate your ears. Do you feel any tenderness?
No.
No tenderness? Okay, awesome. I don't feel any masses. I don't see any lesions whatsoever. I'm gonna go ahead and palpate your temporal mandibular joint. Go ahead and open up. Close. Do it one more time. so that's good. I'm also gonna palpate for your lymph nodes, see if there's any abnormal swelling going on up in there. So your preocular, postocular, occipital, submandibular, submental, posterior cervical, anterior cervical, supraclavicular. Now I'm also going to go ahead and palpate your lymph node, okay? Oh my god. Your trachea. Wait, is it? Yeah. Okay. And I'm also going to remove this mask just. Okay. Go ahead and swallow for me. Okay, no abnormal swelling present, which is great. And now I'm also going to go ahead and perform a whisper test on you, okay? So I just want you to go ahead and cover up one of your. Awesome, thank you.
Red bus.
Okay, and now same with the other ear.
Blue bell.
Awesome, thank you. Okay, so cranial nerve 8 is intact, and now we're gonna go ahead and inspect for cranial nerve 7, which is olfactory. Correction, cranial nerve 1, which is olfactory. So I want you to go ahead, close your eyes, and let me know what you smell, okay? Close your eyes.
Alcohol.
Awesome. Okay. And now I'm gonna go ahead and inspect, oh, no, correction. I'm gonna go ahead and palpate your sinuses, okay? Go ahead and remove your glasses for me. Okay, and let me know if you feel any pain.
Okay.
Any pain?
No pain.
No pain. Awesome. So now I'm gonna go ahead and test for cranial nerve 12 and 9 and 10. Go ahead and stick out your tongue. Move it side to side. Okay, now go ahead and open up your mouth. Say ah. Pharyngeal movement's intact, and then I would also test for gag reflex, but we're not going to do that today. Okay, so now I'm also going to go ahead and test for cranial nerve 5, which is a light touch test. Go ahead and close your eyes, and let me know when you feel light touch, okay?
Now. Now.
Okay, awesome. I'm going to go ahead, toss this out. Now I want you to go ahead and clench your jaw for me, and I'm going to push down on it slightly, okay? Awesome, so cranial nerve 5 is intact, and now I'm also going to test for cranial nerve 11, which is accessory muscles.
Okay.
So go ahead and shrug your shoulders. Awesome, sorry. And now go ahead and turn your head against my hand. Awesome. Awesome. Cranial nerve is intact, and that is cranial nerve 11. And now I'm gonna go ahead and inspect your arm, so if you can just go ahead and lift up your sleeves. Okay, thank you. So skin integrity off the bat looks really good. I don't see no bruises, no masses, no lesions whatsoever. Temperature is good throughout the arms. Now I'm gonna go ahead and I'm gonna palpate for your brachial, radial, and test for capillary refill as well, okay?
Okay.
Brachial artery, I would label it 2+ within normal range. Same with the radial artery, 2+. Now I'm going to test for capillary refill. Okay, less than 3 seconds. Now I'm going to go ahead, look at joint mobility. No swelling, no discolorations of the joints. Good mobility. Do you have any pain when I do move your joints?
No.
No? Okay, so now I want you to go ahead, do this, check for range of motion, not down, okay. Okay, so you have proper range of motion, go ahead, thank you. And now I'm gonna go ahead and inspect your chest, okay? You can just go ahead and take off your gown. Okay, so I'm gonna go ahead and look at your precordium. I don't see any pulsations, no throws, no heaves whatsoever. Looks really good. No bruising, no lesions at all as well. I'm gonna go ahead and inspect your back. The back looks good. Your spine is aligned with your head and neck. I don't see any pulsations or heaves back here either. Skin integrity looks intact, no bruises, no lesions, masses. Okay. Chest also, thoracic cage also looks symmetrical between front and back. Okay, and now I'm gonna go ahead and palpate your precordium, okay?
Okay.
Awesome. I didn't feel any masses. Did you experience any tenderness while I was palpating you?
No.
No? Okay. And now I'm also going to look at your respirations. I don't notice that you have any flared nostrils when you're breathing. I don't see that your breathing is labored, so that's good. No pursed lips, and I don't see that you're using your accessory muscles at all either. So that's good. I don't want you. Okay, and now I am going to go ahead. One thing I did forget, I'm going to palpate your carotid artery.
Okay.
So I'm only going to do one at a time. I don't want to cut the blood flow to your head and have you pass out. Okay, both sides are bounding 2+ within normal range. Okay, and now I'm going to check for tactile firmitis. I'm going to start with the front, and then I'm going to have you turn towards the wall. So then, okay. So go ahead, take a couple of deep breaths. Say 99.
99.
Okay.
99.
Awesome. So it's resonant in the front. Did notice chest expansion in the front was symmetrical as well. And even, okay. Now I'm going to have you turn towards the wall. And now I'm going to check for chest expansion. And then also, once you're done taking that deep breath, say 99.
99.
Okay.
99.
Okay, awesome. I did notice it was resonant around the scapulae, and chest expansion is even as well. Okay. Awesome. Okay, and now I am also going to go ahead and I would percuss for any dullness with the respirations as well. And now I'm going to go ahead and take respirations for 30 seconds and calculate how many respirations per minute, okay?
Okay.
And we will begin. Awesome. So I did count 9 respirations for 30 seconds, which means 18 respirations per minute, which is within a good normal range. Okay. And now I'm going to go ahead and begin auscultating. I'm going to start with the cardiac assessment first. I'm going to work up to the respirations, and then I'll start with, I'll go over to the posterior side, okay?
Okay.
I'm going to start off with auscultating your carotid artery with the bell of my stethoscope to see if there's any signs of bruise. No signs of bruise noted. And now I'm going to switch over to the diaphragm to begin my cardiac assessment. So I'm going to start in the second intercostal space to assess for your aortic. And now your pulmonic, which is as well in the second intercostal space. Okay, both sounds from the aortic and pulmonic is S2. That's the most predominant sound.
Mhm.
And now to begin with the Erb's point. Erb's point's on the third intercostal space, and it is equal on both S1 and S2. And now time for tricuspid. Tricuspid is on the fourth intercostal space, and the most predominant sound is S1. Now time for mitral. And it's on the midclavicular line, and predominant heart sound is S1, and I am gonna take pulse for 1 minute. Starting now. Awesome. So 87 beats per minute, okay?
Mhm.
So now I'm gonna go ahead and assess your respiration for the respiration assessment, okay? Okay, I'm gonna listen to any bronchial sounds that you have up here on your neck. Okay, bronchial sounds heard. And now I'm gonna go ahead and start the ABCs of your chest. I do hear some bronchiovesicular sounds. I didn't hear any adventitious sounds, or I did hear vesicular sounds as I went further out. And I'm gonna ask you to go ahead and lift up this arm.
Mhm.
Okay, no adventitious sounds noted. No adventitious sounds noted as well. And now I just want you to go ahead and face that wall for me. And I'm also gonna perform the auscultation assessment part of this, and just on your back, okay? Go ahead and take deep breaths. Awesome. Okay. So I did hear bronchiovesicular sounds near the scapulae between both of those, and then further out was vesicular sounds. Okay, and now I'm gonna go ahead and test for costovertebral angle tenderness before I have you lay down for your abdominal assessment. So at any point, just let me know if you feel any tenderness upon palpation, okay?
Okay.
Any tenderness?
No.
Awesome. Okay, so if you just wanna go ahead and lay down for me, I'll go ahead and assess your tummy. Okay. Off the bat, your contour looks great. Flat stomach, nice even color distribution. I don't know any impaction to skin integrity here. I don't see any scars, no surgery scars, no tubes such as ostomies or anything of that sort. So now I'm gonna go ahead and auscultate your abdomen, okay? I am gonna listen to the aortic to see if there's any aortic bruits. It's typically gonna be 2 finger spaces above the umbilicus. No aortic bruits noted. And now I'm gonna switch over to the diaphragm. I'm gonna start at the right lower quadrant. I'm listening to any abdominal sounds. No more active vowel sounds. And now in the right upper quadrant. Same with the right upper quadrant. Now I'm on to the left upper quadrant. Awesome. I only heard normal active vowel sounds, which is really good. That means there's no impactions to your abdomen. And now I'm gonna go ahead and percuss. It was tympanic all around. I only heard dullness over solid organs such as your spleen and liver, okay? Now I'm gonna do a light palpation on you, which is only like 1 to 3 centimeters, okay? Just let me know if you feel any pain. Okay. Since you didn't state that you felt any pain, I'm not gonna do a deep palpation, which is 3 to 5 centimeters. Not needed unless you did feel any pain or if I felt any masses, okay?
Okay.
So now I'm gonna go ahead and inspect your arteries on your bottom extremities. I'm gonna go ahead and feel for your popliteal artery. Pulse is bounding 2+ within normal range. Your posterior tibial. 2+ within normal range. Dorsalis pedis. 2+ within normal range as well. And then for Millie's femoral artery, it would be around the groin region, which we're not going to palpate on her. And now I'm going to go ahead and test for capillary refill, okay? Which is, capillary refill is less than 3 seconds. Good, I don't know any cyanosis whatsoever. And then I'm also going to assess for skin integrity. I don't know any masses, bruises, or lesions. No signs of edema. Okay, and temperature all around is good. It's even within both legs. And now, Billy, you can go ahead and sit back up. test for mobility. I want you to go ahead and bring your legs forward. Awesome. Okay. I want you to go ahead and push down. Okay, awesome. Mobility for bottom extremities is good. I'm also going to test mobility for upper extremities as well. Okay. Now I want you to go ahead grasp onto my fingers. Awesome. Push against my palms. Amazing. For mobility overall in your entire body, I would rate it a 5 out of 5. Getting stronger every year. Okay. And then also, I forgot to mention the test for murmurs. I would have you lying supine on the left side, but since I didn't notice any like adventitious sounds or any, well, that's with your breathing. But since I didn't notice any out of the ordinary sounds with your heart, I didn't need to. Overall, really good. Do you have any questions?
No questions.
No? Okay, so if we were in a hospital setting, I would have the bed at the lowest possible stage with a 2-side rose up, but here's your call bell.
Thank you.
You let me know if you need anything. I am gonna go, almost forgot. On a scale of 0 to 10, are you in any pain?
No, 0.
0 pain? Okay, so I'm gonna go ahead and open up the curtain, give you your freedom. Just gonna go ahead and perform hand hygiene and document my findings. Thank you.
Thank you so much.